possible COVID exposure team. We're preventing our patient population from getting additional exposure. So we are assessing patients before they enter our double doors in our normal emergency entrance, and if they present with any possible symptoms or have had any kind of exposure, we direct them to our outside tent area. We're maintaining our 6 feet of space. We have designated team members for designated providers. We're assessing, we're screening, we're doing outside x-rays. We have our donning and doffing. We're sending our COVID testing. We're encouraging people to do social isolation, self-isolation. We're providing resources for people in the community who can't necessarily self-isolate because they don't even have a home to isolate in.
So when patients come in, we make sure that anybody with respiratory symptoms, cough, shortness of breath, we try to separate them from the rest of the other patients. And that's why you could see tents, is because we try to separate them. And then from there we determine what is the proper approach or treatment for these patients. So it's really just trying to make sure that we're not spreading the virus. So we're being extra cautious. The big tent came up yesterday because we are anticipating that there may be more patients coming in, and we want to make sure that we have the space to keep everybody safe and everybody separated.
So it's a nasopharyngeal swab collection. This is the collection kit. So this is what our staff use to collect a specimen. So it is a really thin cotton swab inside that is inserted through one nares, and it goes about halfway back, distance between the nares and the earlobe. It stays in there for 5 seconds to collect the specimen, and then it's removed and then placed in the vial here. And then this vial is walked over to our lab for determination of processing. So it is slightly uncomfortable. It's kind of feels like if you have water down your nose from swimming, that kind of a burning sensation for a slight second. So if they're needing care, we obviously will follow through with that, and then depending, the disposition of the patient is either going back home, which then it's in contact with public health and self-quarantine, and then if they're needing to be admitted, then they would be admitted into our hospital.